All right, everyone, welcome. Still a couple minutes until the top of the hour. We'll get started here shortly. Welcome to the latest and the only microneedling webinar for December on treatment serums. We talked about home care last time. We'll talk a little bit about in-treatment serums and how that differs. So we'll get started in about 3 or 4 minutes. We posted the live link to this, the Dermapen 4 microneedling CME accredited online training course where you can get actual accredited training and send it to your medical malpractice carrier so that hopefully you can get some discounts on your insurance. If you look at the tab with the triangle or the button on the bottom right with the triangle, square, and the circle, you can see the live link for that there under question and answer. And if you have any questions during the presentation, feel free, again, tap on that triangle, square, circle, click Q&A, and go ahead and type those in. I will answer those at the end of the presentation. So hang tight. Thanks for joining in early. We will get started in a couple of minutes. All right, everyone. It's 2 minutes after the hour. We're going to get started with our presentation. Thanks for joining for this, the only DP4 webinar in December. I'm Gregory Zengo. I am a physician based in Georgia, and that's a little bit about my bio. I am originally an OBGYN. I formerly taught at Emory University, went off into private practice, and quickly discovered the combination of both wellness medicine and aesthetic medicine in the early 2000s. Started out with a few missteps, like buying a bunch of equipment that plugs into the wall. And that stuff never made anybody any money. And the stuff 20 years ago didn't get a lot of patients better either. You either got a substandard treatment or someone got burnt. There wasn't a whole lot of middle ground there where it was therapeutic. But anyway, kind of learned as we went and realized that aesthetics and wellness, especially when combined, was a really important tool to have in a practice, especially as your practice matures. And our patients requested it. They wanted it, so we started doing it. I've been doing Botox since 2002, fillers since 2004 when they were first approved. I founded Practical CME Medical Training in 2008. and we are responsible for the fully accredited DP4 microneedling training course. And if you have not had any accredited microneedling training, you need to get this. You can purchase it through DP4, Dermapen USA, or dpderm.com. And the link is over in your Q&A tab. So click on the triangle, square, and circle in the bottom right. Click on questions and answers. You'll see the link there. The reason why you need it is you can get discounts on your medical malpractice insurance when you show them you have accredited training. And if you ever get in trouble, or if a patient perceives that they got an injury and you don't have any accredited training, you are more likely to get in trouble or be forced to settle. So it's really important to have that kind of training and have that proof. And when you do our training, you'll learn a lot. You'll have lots of clickable links to the medical literature, and you will be able to print your certificate upon completion of the post-test, which is absolutely fantastic. We have been teaching this since 2014. It was originally embedded inside of our platelet-rich plasma course. We broke it out free, so you can just learn microneedling if you want. It is fully CME accredited, whether you're an MD, a DO, nurse practitioner, PA, or registered nurse. So yeah, and we now have 11 hands-on locations, not 10. So this is really cool. Going into 2025, we're adding Houston, Texas in for our live training. Now for microneedling, you really don't need live training. We've got lots of videos on there. The key with microneedling is the brain power, the brain work, and that is selecting the right patient for microneedling, getting the expectations right between yourself and the patient, choosing the right serums and that we're going to use during the case, and we're going to focus on that tonight, and the wide variety of options you have, and then planning the intervals right, the depth right, and of course your patient instructions right, and then that patient will see results and they will renew their treatment packages, and that's what you get when you have happy patients. Microneedling is never a one and done like we've talked about in others. You don't just sell one treatment. You don't just do a treatment without proper home care and proper in-treatment serums either. So we'll talk tonight. Our agenda is going to be pretty straightforward. We talked about home care last time. Now we're going to talk about in-treatment protocols and some of the choices you have there. And because you are a provider, you are licensed, and you are doing this in your practice, you have the ability to use serums and substances that might be a little stronger than the patient may choose to use at home. And there are some ways you can take advantage of this, and there are other ways where you should be really, really careful. So we're going to talk about choosing the right treatment serums for pigment, for wrinkles, for scars, for scalp. Of course, the official FDA indication for microneedling, we always have to say it, is scars. But these other indications that are used off-label are very effective, and certainly we can talk about that, and you have the opportunity to use microneedling for these purposes as a provider if you are properly trained. One of the things you need to realize in order to sell microneedling treatments to somebody else, you need an FDA cleared pen. If you are out there using any microneedling device right now that is not one of these 6 listed here, Skin Pen, Candela, Eclipse Evo, Rejuvepen Skin Stylus, or DP4, you are not practicing the standard of care. This is a procedure that requires FDA cleared equipment. So anything else you should not be using if you are doing this as part of your practice and taking money for it. And that includes every single roller or stamp out there. So it doesn't matter if it's sold to you, doesn't matter where you bought it from. If it's not one of these 6, it's not FDA cleared. Don't do it. With that, you also need the combination of training. And our training course, again, the link is in the triangle, square, circle question area. That is the second part. So your training, your equipment, and then the knowledge of how to use it, and you will have a really successful practice. And I will tell you, as a physician doing this in my practice, in the 1 year and 3 months I have used the DP4 equipment, compared to the 2 prior FDA pens that I had used with the treatment regimens that were offered by those companies, I have now seen a doubling of my initial patient packages sold, meaning I'm getting twice the number of new patients, a tripling of total treatments performed, and now a 5 times rate of package renewals. So I ask you, if you've been doing microneedling, how is your practice going? How is it growing? And are you seeing this kind of really excited renewal of treatment packages at 70%, 80%? And if you're not, let's think about what might be wrong. Is it your equipment? Is it your in-office serums? Is it your home care? And last week we talked about, of course, the home care. And one of the things I always like to show is this slide from 2011. It's an oldie but a goodie. Slide A is baseline. Slide B is topicals only. Slide C is microneedling only. And slide D is when you combine topicals with microneedling. And you're getting this really nice linear appearance of new collagen being laid down. This is not scar collagen. This is good, loose, flexible collagen. And that's why I always say half of this benefit is the treatment, the channels themselves. Half of it is the topicals you use, both in treatment and at home. So we're going to talk about the Mesoglide serums that are available through DP Derm. And there are, of what I would call the basic serums, the basic MG serums, there are 5. There's HA35, HA35 plus, RAS, BL, and CLR. And we're going to go over all of those one by one with indications. Now, all of these NG serums have triple molecular weight hyaluronic acid called Hyalofuse. It is a blended hyaluronic acid with molecular sizes that range from 10 kilodaltons to 1800 kilodaltons. And the large size of these hyaluronic acid molecules is extremely important because we have proof, and the CME course shows the article and talks about that proof, that this proof shows that these substances, when they are high molecular weight, have a lower inflammatory result than using the the low molecular weight or digested HA. And it's pretty simple to know what to do in that situation. So when you use high molecular weight HA, you get better results. You get less triggering of pigment. And when you use the stuff you find on Amazon that's in a dropper bottle, that when you drop it on the side of your hand, it rolls down the side of your hand, that's a problem. That's low molecular weight, and that's going to be very pro-inflammatory. So again, it's really important. And there's a lot of people out there that are doing microneedling just using products they're picking up at CVS or Walgreens or off of Amazon. And just because it is called hyaluronic acid does not mean it is the same, okay? And that's really, really, really important going forward. So keep that in mind, and we will touch on this a little bit more as we go through these other MG serums. Here's a little comment about Hyalofuse, and this is the presence of this hyaluronic acid after application. And what you find is that immediately when you put it on these freshly made channels, you're going to get that really, really good deep penetration. 2, 4, 6, and 8 hours later, you're still going to have presence of Hyalofuse in these channels as you go. And that's really, really important. And the fact that you know that this is a high molecular weight hyaluronic acid means that you're not going to get that pro-inflammatory neutrophil-based kind of effect that can trigger pigment, can increase the microscopic appearance of scar tissue underneath, and have some untoward effects. Because the last thing you want to do when you're doing microneedling is to get a result that may be even a little bit worse than what you expected. So the workhorse basic serum that you use during treatment is HA35. And when I'm not sure which one to use, or a patient has multiple pathologies that we want to try to treat, HA35 is often used for at least some of the treatments. You can use it on scalp, you can use it on scars with or without PRP or exosomes. You can use it for general anti-aging, and it's sort of my choice for basic general anti-aging along with HA35 plus. And the key ingredients here are all the things that we've mentioned in prior webinars that are helpful to promote the laydown of new collagen and the turning off of pigment, in addition to filling in wrinkles and improving glow and texture. And that is copper peptides, which are that antioxidant to help those little channels heal in the most scarless way possible. Hydroxyapatite, zinc, B5, and then, of course, the Hyalofuse. This can be used straight up. You can mix it with other serums, 50-50. You can mix it 50-50 with exosomes. We'll talk a little bit about exosomes later on if you want to save a little money and not use the exosome straight, for instance. So you have a lot of options with this. So this is what I consider to be the serum we use mostly. Now, they have a product that patients can also use at home called Hyla Active, and it's present in a lot of the home care kits that they sell. And that is a lower concentration of hyaluronic acid than what you see here. So the treatment serum you're going to use in the office one time immediately during and after the treatment is going to be a little bit more intense than what they're using at home. And that's important because you want to keep the home regimen reasonably priced. Hyaluronic acid is a polymer, so it can be as long as you want it to be. And so not all hyaluronic acid is the same. So when I talk about low molecular weight versus high molecular weight, you know, they're all called hyaluronic acid. The molecular weight in here is going to be a little bit higher than the molecular weight in a home care regimen, although there's still high molecular weight. And it's going to be way higher than the watery stuff you see in the dropper bottles from Amazon or out in retail. HA35 plus is the same as HA35, but it adds some GGPs, vitamin A and E, and other ingredients that help with inflammation, wound healing support, Centinella asiatica as well. So it's a little bit of an amped up HA35 plus. So this is going to be my treatment of choice for mostly anti-aging and wrinkles in patients 50 and up. And when patients have multiple issues, HA35 plus is often going to be the one I'll choose first right out of the gate. And then the next three I'll talk about are more specialty oriented, and I may switch to those and alternating treatments if they want to then focus on pigment. The only thing I have noticed with HA35 plus is that for some patients who have really sensitive skin, they note some prolonged redness when I use these serums. And so if that's the case and they have really sensitive skins, I might back down to the HA35. So that would be the reason why I don't use HA35 plus in everyone. A first treatment, I might try HA35, then I might bump up to the 35 plus in the second treatment if they showed that they could handle the 35 easily. Bright Light, or BL, is probably the most common specialty treatment serum I use in my practice. And this is for hyperpigmentation, melasma, uneven skin tone. And the reason for that is the presence of the kojic dipalmitate. We talked in prior webinars, and you can see the archives of them, how the melanin, the cascade of melanin production and storage in the keratinocytes goes in the skin. And there are multiple parts of that process where we need to disrupt it. And kojic will disrupt it many places along the way. The problem is most of these things don't absorb very well into intact skin, only about 7 to 10%. So when you have these microneedling channels, why not put the absolute best, most concentrated package of these ingredients on that skin so they get to the bottom of the channels for you? Now, one thing I want to mention that's really important is that these microneedling channels tend to stay open pretty nicely for about 30 minutes. So you need to do your needling quickly. Generally speaking, you want to do a needling of a face in about 6 to 8 minutes. And that can be done doing 3 passes, overlapping, vertical, horizontal, diagonal, and moving along briskly, needling through your serum. But then it's important that you apply that serum again at the end of the case, because those channels are going to swell shut a little bit, and then they will stay open for around 3 to 4 days after that a little bit of initial edema in the channels. So it's extremely important. Don't just assume that the needles are going to drive all of the serum you need into the skin. You want to do that second application of serum before you put a mask on or sunscreen or send them home. So bright light, again, whichever serum you use, you're going to put that on liberally at the end of the case. Bright light indication is pigment. If pigment is the patient's #1 issue, this is what I go to first. If it's pigment and wrinkles equally, I'll probably come in with this first treatment, may switch to an HA35 plus in treatment 2, come back to this in treatment 3. But pigment is the one indication that requires the most treatments. It's the shallowest depth, it's the quickest, easiest recovery, but it's the most treatments. So you need to come over and over and over again, shallow, consistent, with a shorter time interval like 4 weeks, and using this serum every single time. RAS is for scars. And it can be also used for rosacea or hypopigmentation. I will say, don't have a lot of experience with that in my practice. It also will work nicely with wrinkles, but it's got a little bit of retinoid in there as well, and it's a lot better at softening those scars. Now, scars are going to also be dependent on your depth. So this is the one situation where the mechanics of the pen, the mechanics of the needle do take precedence over the serum, and a well done microneedling of a scar, making sure that you get those channels all the way to the bottom of the scar and draw a little bit of blood out of those channels to prove that you actually traverse the entire scar, is going to be crucial. Because if you're too shallow, even a great serum like this isn't going to help you too much. So you have to get full thickness through the scar, and the DP4 pen is fantastic at that because it has this really high torque scar setting where you can go as deep as 3 millimeters, but because the motor is, the RPMs are lower, it can use more of that motor power for torque and energy to drive those needles down rather than frequency. So with scars, I'll use RAS. I'm also a big fan of PRP with scars as well. Scars and scalp are the 2 places I do like to incorporate PRP along with these serums. Same thing's true with exosomes, which we'll talk about in a minute. CLR is one that is used mostly for acne or large pores and oily skin where you want to control it in all age groups. Generally, this is going to be people in their late teens and 20s. And it's got a lot of ingredients that we don't see in the other treatment serums like oligopeptide 10 because of the antibacterial nature of these treatments, because we don't want to stimulate new breakouts, especially in all of these very vulnerable channels that we're making. But it also has some kojic because we know issues with acne and pigmentation often go hand in hand, because anytime you have an infection that is healing and the potential for sun exposure to activate pigment, you can run into trouble. Now, those are the basic in-treatment serums, and these little vials you see here are usually enough to do 2 cases of the face from hairline down to jawline. The next 2 I'm going to talk about are upgrades, and these are a little bit more expensive. So these will be about a $60 upgrade. That's a patient charge. So the MG Exoskin, I would say the indications here are the same as the MG RAS, but also maybe the MG HA35 plus. So deeper Rhytids, a patient who wants, quicker, more impressive results, and something where you want to really do everything possible on scars. And of course, the key ingredient here are the stem cell derived exosomes. And these are, which I'll show you, little vesicles. These are little natural vesicles that are used for cell-to-cell communication that have growth factors inside. And these little vesicles, when you needle through them, they will open up and release these growth factors into the needling channel. So the trauma of the needling will disrupt these vesicles sufficiently enough that you will get release of their contents. And there's a tremendous amount of growth factors, very similar to the growth factors you see in PRP, without the pro-inflammatory nature of PRP. So I think this is really cool. But because these vesicles are not actual human cells, and these vesicles don't have a nucleus and mitochondria and all of that stuff, they are very low inflammatory, and they don't have a lot of issues with creating inflammation, rejection, scar, things like that. So that's going to be really important. And you can see here a lot of the growth factors we find in PRP, EGF, TGF beta 1, TGF beta 3, which is a really important one for scarless wound healing. You also see in these properly made, well-designed exosomes, except the beauty of the exosomes are these little packages of growth factors are shelf-stable. And so you can give them to the patient to use at home, and DP Derm has a home care exosome regimen, or you can use the more concentrated exosomes in your MG serum in the office. So this is an upgrade. I think this is a good upgrade. If I was going to use the same indications for exosomes as I do for PRP, I would definitely do it on every scar case. I would definitely do it on every scalp case, but they just released, and the other great thing about exosomes and DP Derm is that they're always innovating, and just last week, you can now start to buy MG Exo Grow, which is a little bit different for, because it's got the 5-alpha reductase inhibition for scalp. So you're getting all the benefits of exoskin, but for scalp. So I would now use this on the scalp. Prior to 2 weeks ago, I would have recommended just using the other exosomes on the scalp, but now we actually have that distinction. I think exosomes are going to replace PRP eventually. They're just too easy to use. We just need a little bit more data on them. You know, it seems like the pilot studies we've seen with lesser quality exosomes have shown really nice results in split face studies. We just need to continue to see that. I feel very confident in what PRP can do. It's not the greatest thing in the world. There's room for improvement. PRP also can be pro-inflammatory. And so that a lot of that depends on how it's prepared. If you're doing something like Miss Kardashian got here and want to look really dramatic in a picture, you got too many darn red cells. And those red cells can stain. They can also, when there are red cells, that means there's also granulocytes, neutrophils, things like that. And when you have those, that's pro-inflammatory. So staining, pro-inflammatory issues, you're not going to see those with exosomes. So ideally, if an exosome can do all the benefits that PRP can do while being shelf-stable and not pro-inflammatory, it's a complete home run. I think it will turn out to be that way. We just need a little bit more time. So I'm starting to trickle exosomes definitely into my practice for patients that want to be at the cutting edge. And we all know who they are. You have them in your practice too. They always want to do what's new. And that's who we start using exosomes on in our patients. Again, just brief to finish up. We talked last time about home care, and the beauty of these home care regimens is that you have 4 to choose from. And so if you use the HA35 or HA35 plus, you're probably going to use the anti-aging starter kit. If you use the BL serum, you're probably going to use the brightening one. Pre and post procedure is generally a good all-purpose kit to use. It's also good to use on sensitive skin. And then the problematic would be wherever you used the MG CLR for acne. Another thing you got to realize, if you look at all this and say, oh, well, MG serum, it works out to be about $12 per case. And if you want to use exosomes, it's going to be about $60 per case. But the thing is, you're only paying $24. I just redid the math. It's a little cheaper. $24 for a needle head, $12 for the serum for the case. It's only about $8 per case for the home care starter set. So you're spending about $56 to do the treatment, and you're giving them the best, well-matched material to use both during the case and at home, as opposed to another company where you're paying $60 for the needle head and a tube of glycerin and no home care. And so this is how I view switching from one of the other pens to DP4, is I can keep my prices the same. I can upgrade my treatment, upgrade my results, give the patient something nice to take home. And I think that has a lot to do with why they're renewing, because they're getting cared for in the office as well as at home. And it's not costing them any more. Of course, expectations are really important. Never do anything less than a series of 4 treatments when starting someone out, and make sure you get your treatment intervals right. The shallower you go, the more frequently you can do them. So shallow acne, pigment. Scalp is not shallow, but most of the literature shows you can go pretty hard and do them monthly. Generally speaking, for wrinkles and anti-aging, I'm going every 6 weeks. I'm going about every 8 weeks in scars. Because every time you give needling channels, you make collagenase, and you don't want to make collagenase while you're trying to lay down new, fresh collagen at the same time. So that's pretty much all I have. I'm going to get to the questions in a minute, but just remembered one thing: if you want to do microneedling and charge people for it, you need an FDA-cleared device and you need accredited training. That is the standard of care. If you don't have both, you are practicing below the standard of care. So take a look at this training course. It's very affordable. You get 2 years of access. You get a direct line to me for questions. The training is also updated frequently as we continue to have new developments. We'll be updating it to add the Exo Grow here shortly. And those treatments are pushed to you at no additional charge for 2 years. So let me go and check out some of the questions we have so far. So Leslie asked, are there any examples where you think PRP is better than exosomes? So I don't have enough. So exosomes is a very broad category. And my first question back to you would be, whose exosomes are you talking about? What brand? What is their source? And then what clinical data do we have on those exosomes? And a lot of the answers as you dig deeper in exosomes is I don't know. You know, the DP Derm exosomes are state of the art. They are amniotic generated, and so there's going to likely be less inflammation, less promotion of scar tissue, which I like. Robust growth factors. It's a renewable source, so I like it. Of course, as with anything new, it really depends on your desire to be an early adopter. PRP sounded pretty darn crazy for cosmetic use 15 years ago. Ortho was using it. They were using it in burns. You know, draw someone's blood, spin it, take out the growth factors, and inject it into someone's face. So that has an FDA status. And as long as you use an FDA-cleared kit to make your PRP, and we talk about that a lot in our big training course that's over 5 credits on PRP and microneedling together, that can be purchased at practicalcme.com. Because we have that status with PRP, you can inject it into the skin, but with exosomes you can't, because it does not have that status as an injectable. So exosomes are only topical. So I don't know if that makes PRP better, but when I need to get growth factors to the sub-Q fat, when I'm trying to work over time to fill in deep pockets of lost volume in an aging face, I can't do that from the top down with microneedling. Microneedling is only going to get me a millimeter and a half deep. I'm not going to get all the way down to the fibroblast. So I can't inject exosomes. I've got to inject PRP. My feeling now with this line of exosomes is that over the next few months, I am probably going to be offering more of the exosomes in the topical part of my treatment through the microneedling. And then if they still need the deeper effects, I will still be, of course, injecting dermal fillers like Juvederm and Restylane, but I'll also still inject activated PRP in there with the fresh filler because I can't inject anything else that is trophic to tissues. So PRP has a status where I can inject it. But honestly, compared to what I'm seeing now with exosomes, where we are now, the theory of exosomes makes me prefer it over PRP for topical reasons, meaning either topical home care for patients on needled channels that are a day, 2, 3 days old, or in a treatment serum in the office. Because again, the exosomes are shelf stable. I know what I'm getting. I don't have the expense of preparation. Yes, exosome treatment serum might be a $60 upgrade, but it also costs me about $110 to spin blood. And it's time for my nurse, and it's additional time for me to withdraw the fractions and activate it. Calcium chloride, which we use to activate PRP, is hard to get sometimes. It's expensive. You have to buy it in large quantity. Now it's very hard to buy small quantities of calcium chloride. So all that stuff together makes me think, you know what? PRP's becoming a bit of a hassle. So it's definitely something you should get a box of and try. Maybe even do a split face in some patients who might be interested, and do the exosome upgrade just on one side and see what they think. And you can then, of course, do exosomes everywhere if after a couple treatments they notice the difference. So there's a lot of fun things that you can do there. If you have any questions, the audio is all closed. Go on ahead and type in the question and answer area, which is the triangle, square, circle on the bottom right corner of your screen. I know we're 5 minutes over, but I'll wait and see if there are any more questions. Microneedling is fantastic. I love it. I love it even more when using really good equipment and really good treatment serums that I know I will get predictable results from. But when I can do it all without charging the patient more than I used to, that's really a win. And it's been a real win for our practice as well. So I think that's been really cool. All right. Well, I don't see any other questions. They will let you know when the recording of this is available, hopefully sometime tomorrow. This ends the webinar series for December. We will be back in January with more on exosomes, and we will go on from there. One last question before we go. Hi, is microneedling effective for scalp hair growth? We talk about that in great detail in our training course. That is very patient selection based. And so you're going to need to make sure that your patient is going to be a good candidate. And I could probably spend 30 minutes trying to explain to you who a great candidate is here. But I will tell you this, no treatment will make a new hairline, and no treatment will fill in a completely bald spot. So if you're trying to take someone who maybe has had a recent alopecia, they're recovering post-chemo, or they have a little bit of stress-related hair thinning, and the underlying issues have been corrected, then microneedling can help that person get their hair back a lot faster. So that's the one thing you got to think about. No, this is not going to take a bald spot and fill it in, but it will take someone who has thinning hair, and when all other reasons for that hair loss are being addressed, it will help accelerate the return of a very rich blood flow to that scalp and give that patient all the best possible conditions to regrow their hair. So I consider it to be like fertilization, or for not fertilization, but fertilizing the scalp like you would fertilize or till your soil on your grass. We know that the grass gets deeper roots. We know that the grass is more dense when we aerate our lawn and when we aerate a putting green on our golf course. We should get the same thing when we aerate the scalp. However, if we try to aerate a parking lot, we're not going to turn that into a putting green. All right. On that note, I'm done. Have a great holidays, and we will see you again in January. Thanks a lot for attending. Good night.